C8 radiculopathy. The keyword for C8 radiculopathy is sensory loss over little finger. This in AMC exam means C8 radiculopathy. To differentiate between different types, take a look at this picture. Here, C5 radiculopathy will cause sensory loss over shoulder and deltoid area, while C6 radiculopathy will lead to sensory loss over shoulder and deltoid area, elbow, and also thumb. With C7 radiculopathy, this will lead to sensory loss over shoulder deltoid area, elbow, and also middle finger. And C8 radiculopathy will affect little finger. So please, sensory loss over little finger means C8 radiculopathy. Now let's talk about common peroneal nerve and tibial nerve palsy. Common peroneal nerve supply anterior compartment of the leg. The causes of common peroneal nerve palsy include the following. First, prolonged lithotomy position, as this will lead to direct pressure over the neck of the fibula. The second cause is fracture fibula, especially the neck. And finally, long-term hyperflexion of the knee. So, the keyword for common peroneal nerve palsy will be foot drop due to extensor hallucis longus dysfunction. So common peroneal nerve palsy will lead to foot drop. So please focus on this, as this is very important. Other clinical picture will be foot eversion and dorsiflexion loss. Okay? Foot eversion and dorsiflexion loss. Now take a look at this picture. Here you will see that the common peroneal nerve will pass around the neck of the fibula. So prolonged lithotomy position will lead to direct pressure over it. Fracture fibula, the neck of fibula, will lead to injury of the common peroneal nerve. And also the same for long-term hyperflexion of the knee. So any injury of common peroneal nerve will lead to foot drop, as it supply extensor hallucis longus, and this dysfunction will lead to foot drop. While tibial nerve palsy will lead to loss of inversion and plantar flexion, and it's represented by a word called tib, which means T for tibial nerve palsy, and I for loss of inversion, and P for plantar flexion loss. Okay? And this picture represents tibial nerve palsy, which lead to loss of inversion and plantar flexion. That's all. For full course, please contact us through amcqbook@gmail.com. Thanks and goodbye.